Welcome to Wednesday's edition of COVID-19. For the first time in some 40 days, we have recorded over 600 new infections, and authorities are calling for greater public vigilance as they prepare for public inoculations next week. Accordingly, we have more on vaccines and antibodies later on the program. But first, here is our Kwon Soa with the pandemic updates. So, a rather disturbing figure for Korea today.
Right, Sunny. After more testings on the heels of the Lunar New Year holiday or Seol, cases are rising day by day. Now, 621 infections were reported this Wednesday, and for the first time in 38 days, we are seeing a number above 600. And that also includes almost 600 domestic transmissions, which is also the highest figure since January 10th. Now, for the past 3 days, we are seeing the curve going up here, and also we had a jump of 164 cases from Monday to Tuesday, and also from Tuesday to Wednesday, that is, and also from Monday to Tuesday, we had a rise by over 100 new infections. And with that, Korea is close to 85,000 total infections, and the death toll stands at 1,538. Now, if we take a look at our map now, we have an increase here in the capital region with 258 cases. In the capital, Seoul and Gyeonggi-do province, 154. Here, just recently, 114 cases were confirmed at a factory in Namyangju. And we also see a rise here in Chungcheongnam-do province. This is linked to a boiler manufacturing plant, which we reported about yesterday as well. And there, the total number now is also at above 100.
Right. So, and what is the government's response to this sudden surge?
Well, Sunny, officials say that as the surge came with the end of the holidays, right now it isn't easy to assess whether the upward trend is just temporary or on the back of the increased COVID-19 screenings, or whether it does signal a resurgence of the third wave of the virus here in the country. But what authorities do mention is that recently there was an increase in traveling across the nation. Take a listen.
A further increase in movement could lead to a resurgence of the third wave. Movement across the nation rose by 4% last weekend compared to the week before. And we're now seeing 32.6% more movement overall compared to early January.
Right. Meanwhile, on the international front, so I hear a new coronavirus variant has been identified over in the UK.
Right, Sunny. Scientists have identified 38 cases of a new variant similar to that of South Africa. That's 36 in England and 2 in Wales. And authorities there say that this variant could reduce the effectiveness of existing vaccines. But there is also good news on the global front, as the World Health Organization says that worldwide figures of the COVID-19 virus dropped by 16% last week as of data from Sunday compared to the previous week, and also deaths fell by 10% on the week as well. Now let's take a closer look at the figures now. Nevertheless, we have a total number of 110 million cases now as of noon Korea time, and also we have over 10,000 new fatalities reported in the span of 24 hours. Now there is some positive development in the U.S., which has still, of course, the highest number of infections around the world at almost 28.4 million. But according to data on Tuesday local time, on Monday, the U.S. reported the lowest number of infections since October, and also the lowest number of deaths since late November, as well as hospitalizations have seen a significant drop to around 65,000. Meanwhile, we see another Latin American country here, Mexico, which has surpassed 2 million total infections. And those are the updates I have for now. As it is a Wednesday, we do not have a government briefing, so I will see you back tomorrow. Sunny?
Right, so thank you. I'll see you on Thursday. Right, back on the domestic front, officials here are seeking a better balance between public health and business activity amid the prolonged pandemic. I have Kim Han-il here in the studio with details on that. Right, so as part of efforts to ensure the livelihoods of small business owners, the government is looking to revamp its social distancing framework, Han-il.
Right. So yesterday, Korea Disease Control and Prevention Agency unveiled a tentative timeline for the rollout of the new social distancing framework. But due to the surge in daily figures today, it is unclear when the new guidelines will be implemented. During a press briefing yesterday, the KDCA official Son Young-rae told reporters that the government plans to draw up an outline of new social distancing measures by next week to have them reviewed by experts. However, whether that timeline will be met has now been shrouded in uncertainty. The current 5-tier distancing alert system has come under fire for being unable to stop the third wave of infections and was faced with backlash from small business owners who say the measures imposed unfair restrictions. With the revamped measures, the government is hoping to allow most businesses to stay open and relying on business owners to act on their own sense of initiative and civic responsibility to keep the COVID-19 outbreak under control. The government has also invited industry experts and business owners to an open town hall meeting over the last 2 weeks to discuss revisions to its distancing guidelines.
Right. Meanwhile, I hear there's also been a fresh government pledge for more work opportunities.
Yes, so President Moon Jae-in has pledged to add 900,000 new jobs by next month. He plans to achieve this by implementing more employment in the public sector through cooperation with regional governments and state entities. Job creation has been a top priority for the Moon administration. During his cabinet meeting yesterday, the president urged officials to spare no effort in tackling the labor crisis triggered by the pandemic, expressing deep concerns over the latest job figures. The latest data from Statistics Korea on Tuesday showed that nearly 1 million jobs were lost in the month of January, with the number of jobless people surpassing 1.5 million for the first time in the country's history. President Moon said the January data was a clear sign of shock in the labor market, and he strongly urged relevant ministries to take immediate action in hopes of a quick rebound in February.
Right, Hanel. I also hear hiring trends have undergone a significant change amid the pandemic.
Right, so there's a deepening polarization in the job market where large conglomerates and tech startups continue to hire more people, with small to medium-sized companies scaling down their workforce. According to data released by Statistics Korea yesterday, SMEs have continued to shed jobs for 11 months in a row. A total of 23 million people were on the payroll of companies with fewer than 300 workers in January, 1.1 million jobs fewer than the same period last year. On the other hand, large conglomerates have steadily hired new workers, adding 120,000 jobs in January from a year earlier. Job fortunes have also been divided when comparing different industry sectors. The hospitality industry cut nearly 370,000 jobs over the past year amid the pandemic. The wholesale and retail sector took a big hit as well, with the industry losing over 210,000 jobs in January. However, venture tech startups have been a rare bright spot, showing an 8% increase in total hires. Among startups, the company that hired the most workers last year was Market Curly, an online grocery platform, which added nearly 700 new employees in 2020.
All right, Hannah, that's good to know. Thank you for that coverage. I'll see you again next week.
See you then.
Right, elsewhere around the world, we turn to neighboring China today for a glimpse of the COVID-19 situation there. I have Fabienne Kretschmer live on the line. Hello again, Fabienne.
Hello. Hello.
Right, Fabienne, do start by telling us a bit about the celebrations for this year's Lunar New Year holiday there in China, which ends today, and about the COVID-19 situation in the country.
Yeah, this year is quite different. I mean, usually, of course, most of the people there will be traveling, visiting relatives, visiting family. However, this year we know that the ticket sales for trains and airplanes, they are drastically down, basically more than 70%. Because, I mean, there's not an official travel ban, but travel restrictions, quarantine measurements, etc. So many people were discouraged from visiting their families. I also, visited a lot of suburb settlements here in Beijing where the migrant workers live. And for them, it's a personal tragedy. They cannot see their sons, daughters, parents, which they often only have the opportunity to see once a year. So for them, it's quite drastic. But I mean, the reason behind it is there was kind of a small second wave in China. since January, they registered more than 2,000 cases, which is relatively small in international comparison. But there were several lockdowns of cities and very drastic measures. And one of the measures is also to encourage people from traveling.
I see. Meanwhile, Fabian, authorities there kicked off the inoculation drive with a local vaccine. What is the latest on that front?
Well, I mean, of course, it's impressive. There are already roughly 40 million people, or 40 million doses injected. But you can argue that actually the vaccination drive isn't going fast enough because you have a population of 1.4 billion people. And by all estimates, the Chinese will not achieve herd immunity this year by end of 2021 just because of 1.4 billion people living here. And yeah, here in Beijing, there are more than 70 vaccination centers, and every day the queues are very long in front of them. It's happening, but it's going step by step. And surprisingly, also, there's a big distrust against the vaccine. There was a survey recently in Shanghai, and half of the survey respondents said that they don't want to take the vaccine. And one reason is, of course, right now the risk of getting infected here in China is relatively low. So the incentive to take the vaccine right now might not be the highest compared to many other countries.
Right. Meanwhile, China is also reaching out to developing countries with its vaccine. Tell us a bit about this diplomatic initiative, Fabian.
Yeah, vaccine diplomacy basically just says that you use vaccines to widen your influence in the region. And that's something that's not only unique to China. For example, India is also doing it. But you can argue that China is using the vaccine the strongest on the largest scale to strengthen their political influence. For example, they sent a lot of vaccines to African countries, to Southeast Asia, but for example, also in East Europe. For example, Serbia received a lot of vaccines, Pakistan also. And there was one recent survey from Southeast Asia among the academia there and also diplomats and government people. I found it quite interesting because they said that, yes, we acknowledge that China helped us a lot during the pandemic by, for example, sending vaccines. But on the other hand, we still prefer, like 60% said, we still prefer an alliance with Washington over Beijing. So it's still quite open whether this vaccine diplomacy actually will have a huge effect.
Right. Meanwhile, Fabian, have there been any reports about vaccine side effects with regard to the Chinese vaccine?
I mean, at least here in the country, no. Of course, you have to consider that the media is highly state-controlled here. But no, but interesting is that here the vaccines are not administered to people over 60 or 65 years old. So they still want to wait a little bit to see whether there will be more data on the effects for senior people. But so far, there were not really many serious side effects. Just, I mean, what would be considered normal.
Fabian, WHO officials investigating the origin of the coronavirus in Wuhan have reportedly found signs that the outbreak was alarmingly broader last December than previously thought. How are Chinese authorities responding to these reports?
Well, I mean, I would say this story is a little bit, or was made a little bit bigger by media than it actually is. So what happened is that the Chinese authorities, they showed the WHO delegation proof of 176 cases, COVID cases from December. And if you do the math, then that means that there must have been at least 1,000 or more mild cases, because we only know about the hospitalizations. However, before December, there are no proofs so far yet that there were infections, but the WHO only had the pre-analyzed data, pre-interpreted data from the Chinese governments. And I think it would be very important to get the raw data from the hospitals to do independent verification of those data. And that has not happened yet because the Chinese authorities haven't handed over the data yet.
Right. One final question then. China has also banned BBC World News from airing in the country. How are foreign journalists like yourself there in China responding to this ban?
Well, I mean, for me personally, as a viewer, for example, nothing much has changed because the BBC was already banned in most residential compounds. Actually, you could only receive the BBC in a few international hotel chains. But the explanation of the Chinese authorities is a little bit scary. They argue that the BBC, their reporting is against the national interest. And I mean, that could also be interpreted as a warning for other correspondents like me who report about very sensitive issues. For example, what's happening in Xinjiang or in Hong Kong, which the government could define as going against their national interest. So I would say the whole atmosphere for foreign reporters here in China is getting more uncomfortable.
All right, Fabienne, thank you very much for being with us at this hour with your thoughts.
Yes, thanks.
Right, back here in Korea, campaigns to ensure zero waste are gaining momentum as members of the public and companies alike join hands to further promote this cause. Do take a look.
The COVID-19 pandemic has led more and more people to shop online and order delivery food. And that is causing pollution from plastic packaging to get worse.
Hello everyone, this is Shin Se-byuk. So I am right in front of a local community center located in Seongbuk-gu district in Seoul. So what's going on here is that some residents who are concerned about the growing use of plastic products opened a zero waste store. So let's get inside and take a look at it. So did you notice something unique about the store? This is a zero waste refill station where you can get detergent. So to get your own detergent, you are supposed to bring your own container. It's never convenient to buy, but those who love the idea became a huge fan of the store.
안녕하세요. 네, 안녕하세요.
예, 용기 가져오셨군요.
네.
This resident asked for detergent, then the cashier filled up an empty bottle with it. So why did she come to the local community center to get detergent?
일회용품도 줄고 플라스틱도 줄고 하니 저도 몸소 체험하듯이 아이들에게도 이걸 똑같이 물려주고 싶다는 생각이 들었어요. 그래서 앞으로 꾸준히 이용할 생각입니다.
코로나 감염병 때문에 이제 기후 변화에 대해서 관심을 갖게 되고 주로 주민들이 관심이 많았던 게 쓰레기 문제였고요. 그다음에 에너지 문제 두 가지로 압축이 되더라고요. 근데 일단 좀 주민들이 쉽게 할 수 있는 일부터 좀 해보자라고 해서.
Things get beyond local community level. Now even big companies are seeking solutions for environmental problems.
So from dental floss to body soap, you can find everyday objects just like any other ordinary stores, but please note that these are all eco-friendly items. Also, food and ingredients here are organically grown, and because this is a package-free shop, you are expected to bring your own shopping bag.
돈을 주고 어떤 물건을 구매를 하는데 쓰레기를 사실 막 분리하고 세척하고 또 이제 배출해야 되는 그런 수고로움들도 같이 돈을 주고 구매한다라는 생각이 좀 있었어서 포장을 소비자들이 구매하는 현장에서 선택할 수 있는 옵션이 있어야 되겠다라는 생각이 좀 있었는데요. 그러한 기획들이 이제 조금씩 발전하면서 이런 환경적인 부분들에 대해서도 좀 크게 메시지를 좀 전달해보고자 이렇게 제로 웨이스트 샵 운영하게 됐습니다.
So the store sells something called the Zero Waste Kit. As the name implies, it is designed to cut plastic waste by encouraging people to use something recyclable. So the kit consists of eco-friendly items such as a stainless straw, a cleaning brush, and a biodegradable bamboo toothbrush.
You need to clean it all by yourself, and it's never convenient. Still, people love the idea, and the question is why?
배달 음식 같은 거 많이 이용하다 보니까 일회용기 사용이 많아지고 너무 많은 일회용품을 버리게 되다 보니까 좀 이런 재사용품에 대해서 관심을 가지게 되었고요.
제로 웨이스트라는 문화가 정말 의미가 있으려면은 구매한 물건을 사실 책임감 있게 오래 써주고 끝까지 써주는 것들도 굉장히 중요한 부분들이거든요. 그래서 그런 소비자들이 구매한 것들을 오래 사용할 수 있는 문화 같은 것들을 또 새로 플랫폼화해서 좀 확장할 계획을 저희는 갖고 있고.
The government, under its goal of going plastic-free, pledged to cut the amount of plastic waste by 20% until the year 2025. Remember, big change starts small. With that in mind, why don't we break free from plastic by practicing zero waste in our daily lives? This has been Shin Se-byuk.
외국과 비교할 때 우리나라의 코로나19 항체 보유율이 대체적으로 낮은 수치라는 의견들이 있었습니다. 이 부분은 다른 나라에 비하여 방역 관리에 전 국민이 잘 협조해준 성과로 판단이 되고
In today's studio session, we readdress the upcoming inoculation campaign here in Korea, as well as the issue of antibodies with our panel of experts. I have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Good afternoon.
And I also have Dr. Kim Seung-taek from Institute Pasteur Korea. Good to see you again, Dr. Kim.
Yeah, good to be here.
Right, Dr. Kim, antibodies fight infections. Now, in layman's language, what are antibodies, how are they formed, and what is their role in the fight against COVID-19?
Well, actually, just after vaccination, actually, it also depending on the what kind of vaccines we are using. But most vaccines that actually currently being used, that actually induce two different kinds of immune response in our body. One is generating just antibodies, and the second one is inducing some cell-mediated the immune responses, which we do not know actually for sure at this moment. We do not know all the details. We are actually focusing on the some antibody generation. But these antibodies, not all the antibodies are actually useful for just inhibiting just a virus infection. We are focusing on the only just a neutralizing antibody. Those neutralizing antibodies actually just somehow interacts with the some spike protein, which is some surface glycoprotein of the virus. By interacting with the spike glycoprotein, that also inhibits just the interaction between spike protein and the receptor protein. Thereby, they can actually inhibiting viral entry into the cells. So that's how we are actually just focusing on. So generating a good titer of just neutralizing antibody is a good measure of just whether the vaccination is successful or not.
I see. Professor Kim, as seen in the video before our talk, recent blood tests here in the country of some 5,000 people, I believe, showed 5 had COVID-19 antibodies, translating to roughly 0.09%. I understand the global average is 10%. How do you explain this discrepancy?
I think we have two things to consider. It's very low compared to world average. That means the quarantine process was very well done in our country. And the second thing is that we don't have immunity against this pathogen. So that means we need vaccination urgently. There's a report from India that their antibody positive rate is way high, up to 40 or even more than 50% in some cities. If they live in crowded without proper quarantine measures, the antibody positive rate will rise. And well, since we're going to face new mutants in the future, we don't know whether this antibody will work against the new strain or not. But anyway, it's evidence that we did a good job, and what is left is how to control the possible mutations in the future.
Right. Meanwhile, babies born to mothers who had COVID-19 were found to have antibodies. For more on this finding, I have Professor Jeffrey Morris at the University of Pennsylvania live on the line with us. Welcome, Professor Morris.
Thank you, Sunny.
Right, Professor, please do start by telling us more about this finding.
Sure. Our study measured the antibody levels in a large cohort of pregnant women in our hospital system in Pennsylvania Hospital in Philadelphia, PA. We measured the levels of an antibody targeting the receptor binding domain of the SARS-CoV-2 spike protein in the pregnant mother, and also obtained match antibody levels for their newborns at birth. The newborn antibodies were measured by applying the serology test to blood taken from the umbilical cord. The study was quite large, with a total of 1,471 mother-newborn pairs that were considered. And we found that 6% of the pregnant women were seropositive, meaning that they had detectable antibodies, indicating they had been previously infected with SARS-CoV-2. Of these, 87% of their newborns were also seropositive. All of the newborns who did not have measurable antibodies were for mothers who themselves either had very low levels of IgG antibodies or only had IgM antibodies, not IgG. Now, the IgM antibodies arise quickly after infection, but also wane more quickly, while the later arising IgG antibodies are the ones that endure and confer long-term protection. Thus, the study clearly showed consistent transfer of IgG antibodies from pregnant mother to newborn. And two other analyses provided further support for this conclusion. First, looking at the antibody levels themselves, the data showed a strong positive correlation between the levels in the mothers and the newborns. We found the newborns of mothers with high antibody levels also had high antibody levels. And second, we found the mean antibody transfer ratio to be 0.90. This transfer ratio measures the ratio of the antibody levels in the newborn to the mother. So a value of 1 means that the antibody levels of the mother and newborn are identical. Greater than 1 means the newborns had higher levels, and less than 1 means the newborns had lower levels. So we observed a mean transfer ratio of 0.90, with more than half being greater than 1. This indicates a high level of efficacy in transferring of the antibodies from the mother to the newborn. So altogether, these results clearly show a strong transfer of IgG antibodies from the mother to the newborn, suggesting that the newborns are born with some protection against SARS-CoV-2.
I see. Professor Morris, what can you tell us about the amount of antibodies found in the newborns and its correlation to perhaps the severity of the symptoms suffered by their mothers?
Yes, this is interesting. The antibody transfer ratios did not differ based on the severity of the mother's disease. The transfer was just as efficient from mothers with asymptomatic or mild disease as it was from mothers with moderate or severe disease. So this may be surprising to some, since one might expect women with asymptomatic disease would have lower antibody levels than those who had severe disease, and thus might also be less likely to transfer them in utero. But the transfer of antibodies to the newborns was equally efficient in both cases.
Professor Morris, you talked about some antibodies being able to last longer in the newborns. What is the length of this immunity within the babies?
So that's something that we don't know because the levels of the antibody were obtained from one time point at birth, so we're not sure how long they last.
I see. Meanwhile, Professor Morris, this past weekend, Israel reported its first death of a fetus from COVID-19. How high is the risk of vertical transmission with regard to COVID-19?
Yes, I saw this tragic report of the death of the fetus. And in this case, the mother, fetus, and the placenta all tested positive for SARS-CoV-2 with a PCR test, demonstrating that the fetus clearly had been infected in utero. And we've seen reports in the literature of this type of vertical transmission of active virus from mother to fetus, but they've been very rare, expected to happen in less than 1% of the cases in which the mother's infected. In our own study, we didn't see any evidence of this type of vertical transmission. None of the newborns in our study had positive RT-PCR tests, and none even had detectable IgM antibodies as well.
I see. One final question, Professor Morris, before you go. What is the implication of your finding with regard to ongoing vaccinations across the world?
Yes, that's a good question. This study, the samples were obtained back in August before vaccination had started. So this transfer of antibodies is from natural response in mothers who were infected. Now that vaccination has started and ramped up in the United States starting in December, our continuing cohort is going to have vaccinated women as well. So in future studies, probably later in the spring, we'll have some data to see whether the vaccinated antibodies are transferred as efficiently as the natural antibodies were in this study.
I see. And hopefully you'll join us back then in the spring with those results.
Sure.
Right,
Thank
okay.
you.
Professor Morris, thank you very much for making the time to join us live at this hour with your thoughts.
Thank you very much.
Right. Dr. Kim, studies show those who have recovered from COVID-19 have antibodies that offer protection for as long as 6 months. Having said that, do these people need to be inoculated?
The recovered patient. Well, most of the experts agree that those the recovered patients need some vaccination as well, because somehow just we professionals think that maybe our vaccine might be just a better protection than the even for just the natural infection. And then some people also argue that maybe just one shot instead of 2 shots may be enough, because just the natural infection also already just gave just the prime. So that maybe the second shot maybe just by the probably just given by the just our just vaccination procedure.
I see. Generally speaking, are antibodies induced by vaccines stronger than antibodies induced by natural infection?
Well, mostly we say maybe natural infection is better, because the natural infection gives 2 different kind of immune response, as I told you, just antibody generation, also the cell-mediated immunity. But I think most of the vaccine that we are actually talking about is some modified vaccine, which means that not the natural sequence of a spike protein. We are using, most of the companies actually using some modified vaccine, which is the more technical term is a prefusion state of a spike protein, which is known to be just give just a better protection.
I see. Professor Kim, when can we expect a healthy presence of antibodies after inoculation?
First of all, the main reason we are interested in antibody is because it is measurable. You can measure it. But actually, there are 2 players, as Dr. Kim mentioned. One is the B cells, which produce antibody, and the other one is the T cells, which are engaged in the cellular immunity. And natural infection of COVID-19, the antibody starts showing up in the serum about 1 or 2 weeks after the first symptom, and it maintains about 6 months, I guess. But vaccine is a different one. We artificially inject something inside the body, and our body is reacting against that vaccine to produce antibody. And also that the antibody starts to rise even before the second shot, usually to give 2 shots. And that's for many months, about 6 months, I guess. And the persons who have a high titer of antibody, you also have a very active T cell response also. So that's a good news. And also that activated T cells show up in your body about 6 months also. So, but I'm sorry that it's difficult to measure the T cell function. So we only check the antibody. And you can check the efficacy by antibody alone, but I just want to focus on the Israel's vaccine program. They're using Pfizer, and they're the most advanced country in vaccination. About 45 or 50% are already vaccinated at least once. And the Ministry of Health of Israel said that after 2 weeks of the first vaccine, they show efficacy. I mean, there seems to be effectiveness. And 1 week after the second dose, the efficacy rise to 94%. So that's a good news. And I think it will go with the antibody measure effects. And about other vaccines, it's still a little bit early to say, but I'm expecting similar results from other vaccines also.
I see. And keeping in mind the current data that we have, Dr. Kim, how long will immunity last, especially immunity induced by vaccines?
Well, unfortunately, we do not have enough data to say how long the immunity induced by the vaccination will last, because the phase 3 clinical trials was just done at the end of the last year. So even not just the 6 months have not just passed over yet. So we still have to wait until just have to wait to see the how long our immune response will just maintain after vaccination.
I see. Professor Kim, Korea has purchased 5 types of vaccines, and their methods of inducing antibodies, I understand, are different. Does this reality look to affect our goal of securing herd immunity, in your view?
I hope so. Already we are using many types of vaccines from many companies for the same pathogen. We are already giving vaccines for DPT in many companies. The main issue is how much the vaccine is going to be effective and when it is going to be available for us. And if the vaccine is developed properly, following the standard protocols, I think it will contribute in controlling this pandemic in our country. And as I mentioned, Israel is using only one company, Pfizer, and if we look at other countries such as UAE or UK or United States, they are using various kinds, and they are continuing to use those multiple kinds, and we have to wait for a while to have the results from those countries, and I'm very positive about this.
All right. Dr. Kim, starting today, a homegrown antibody treatment will be administered to patients here in the country. What can you tell us about Celltrion's antibody treatment?
Well, I think those are, well, in terms of it's the cell culture experiment and then some limited in some clinical trials, they actually demonstrated some efficacy. And then I think that's going to be used as for some I think some the mild cases of the patient, mostly with some the high risk groups. And I think, but then one of the concerns we are actually having right now is there's some variant issues. So they're all just the wild type. I mean, sort of just wild type, just the viruses, and the UK, the variant, it's just a Celltrion. The antibodies seems to be pretty effective. But for the South African, they have some efficacy still just reduced. So then I think the company is just trying to just develop some backup, just antibody to just address such kind of the variant issues as well.
Right. Meanwhile, over in the UK, Professor Kim, a new coronavirus variant has been identified, as Al Kwon-so mentioned earlier in the program. And this variant helps the virus escape vaccines and prior immunity. What are your thoughts?
We are fighting against a moving target. The virus never stays still. I mean, it moves around. It means they are mutating. And we must take control of the COVID-19 before it continues to make new ones, before it starts to move and make mutations. So that's the difficult thing. So we used to call this new strain in UK B117, but I think they made a new name for this, Kent variant. And we had a mutant from South Africa, and now we have the last one. It's called B1525, and I don't know whether I'm going to name this, but the last one has accumulation of mutations, and we have to see whether this mutant is going to make higher mortality or not, but it's worrisome. So the vaccine has to be targeting with this kind of events. So we must have a plan B for this situation if we miss the target. And that's the reason why experts should actively engage in the quarantine policy and continue to monitor the new strains. And I would say that UK is the world's best country to monitor the new strains. So every new strain's news comes from UK. And it's glad that we have a very low instance of this pandemic. But even though we have a low distance, we must monitor for the mutations, whether it's coming in from other countries or domestically developed.
Right. Also staying in the UK, Dr. Kim, an antibody treatment by AstraZeneca has been given to 10 people who had recently been exposed to the virus in hopes of neutralizing it immediately. Now, if this treatment is effective, it could be a remarkable way of keeping vulnerable people safe. What are your thoughts?
Well, I think using monoclonal antibody for some prophylactic purpose is not, I mean, it's not really just unexpected things, because we, the scientists, actually thought about such kind of options as well. Because the antibody is actually, we are actually talking about two different kind of immunization. One is active immunization, which is actually just vaccination that we just call. But the passive immunization is the second one. Passive immunization is that instead of just inducing our just immune response, so, such as like generating antibody from our body, but instead of that, we are actually just giving just antibodies directly into the body. That is so-called passive immunization. So the best example of passive immunization is a monoclonal antibody that you talked about, AstraZeneca. And then normally this is not a drug. It's like a drug. So we can actually administer those monoclonal antibody after exposure to the viruses and then after infection, like Celltrion, Eli Lilly, and the Regeneron, the monoclonal antibody. But we can also think about the preventive purpose. So maybe some people, like if some people is exposed to a certain just impacted person. In this case, some like a preventive purpose, we can actually administer therapeutic just antibody to those people. This is for prophylactic purpose. It's quite reasonable, and there is some good scientific evidence. But one of the issues is that still the monoclonal antibody has an issue of some mass production and then cost issues. So in terms of immunization, whether it is active or passive, if we have to just consider the cost, maybe active immunization is much better than the passive immunization. But this is still just a viable option we can just think about.
Is this an option that we're also exploring here in Korea?
I think we can do that. Yeah,
I see.
there's no, the differences in terms of principality and the scientific evidences.
Right. Meanwhile, Professor Kim, are there any words of advice that you would like to share with members of the public here and our health authorities as we prepare for our own inoculation next Friday?
Right now, Israel is the point of interest for me right now. They started their vaccine program in last year, December 19th. So it's been already about 2 months since then. We still didn't start it, so so sad. But anyway, they say that the effectiveness is about 94% if you get the second dose before you are exposed to COVID-19. So it's very good. And but the limitation is that they only check the medical records, so it's not a clinical research. So, but I hope that this is true. And within those several weeks, they vaccinated more than 45% of their total population. I mean, at least they have 1 dose of Pfizer vaccine. So it's very rapid, and the problem is recently the vaccine rate is slowing down in Israel, and the Ministry of Health is concerned about that. Why is it slowing down? Is that because of that some people reluctant to have vaccination, or is it the supply issue, or is there anything? And the Ministry of Health is trying to figuring out why is that. But I think Korea is going to have the same problem in the future. The people who are cooperative will be active to get vaccination in the first few weeks. But as times go by, you don't know what's going to happen if they face news that somebody has some kind of side effects or something happening. It will be difficult. For example, if they have a first dose and they have to go back for the second, and they are thinking, they may think that okay, 1 is enough.
Right.
And the data from Israel said that if you have a vaccination, only the first one, it's going to be effective for about 54% around. So it's not enough. You should have the second one. So. For the age more than 65, we have to be concerned about them, because more than 90% of the mortality and the severe cases come from those age group. So they will be the first to be vaccinated, and as the case of Israel, they have a positive result. So we should keep on that. And in Israel, they are thinking of giving some kind of incentive for the person who got vaccinated. For example, let them allow to go to malls, to visit restaurants and sports facilities, and even travel. So I hope that we can have some application, some kind of QR code in our mobile. So if you are vaccinated, you just show that, and you're allowed to have more freedom. So that will facilitate the vaccine program in our country.
To make greater people to participate. A very quick question though. While countries like Korea are seeking to actively partake in the inoculation campaign, there are countries like Tanzania that have declared we are not going to vaccinate our people. How does such a stance look to affect global efforts to fight COVID-19?
Risky.
Of course.
Risky. I hope that we would not see any kind of new mutant in Tanzania or any country slow in vaccination program, but it should go all together, march together. But if somebody stays like that, the nation's going to be quarantined for quite a while. So it's going to have secondary results.
Right.
Yeah.
All right, Professor Kim, as always, thank you very much for your insights. And Dr. Kim, thank you very much for your thoughts today. Right, vaccines are simply one measure against COVID-19. We need a comprehensive approach to ending the pandemic that ranges from vaccines to prevention efforts to treatments. Having said that, thank you for watching. See you on Thursday.